when we picture a newborn piglet, pink, vibrant, seems like they're just ready to grow. We rarely think of a hidden vulnerability. Yet, as you'll explain, iron deficiency anemia is, well, almost universal in modern production, even in these animals that look perfectly healthy.
It's a fascinating thing, isn't it? And it's sort of counterintuitive. The very practices that have made pig production so successful, so productive, they've simultaneously created this really profound physiological dependency. It's quite the paradox.
That's exactly why we're taking a deep dive into iron deficiency anemia in neonatal pigs today. This isn't just some niche farming issue. It feels more like a compelling case study.
Exactly. A case study in how modern practices, which are incredibly efficient, can sometimes inadvertently create these new physiological hurdles.
Right.
So our mission in this deep dive is really to unpack why it's so prevalent. What are the impacts, on the piglet, on the industry, and importantly, how is research tackling it? Ultimately, we want to give you a really comprehensive understanding of what is honestly best described as a production-induced disease.
So let's start right there.
Yeah.
This idea that it's universal in modern piglets. That's striking. Why them specifically? We don't see this across the board in other livestock or even wild pigs, right?
That's the key question. And it really boils down to what you could call a perfect storm of factors, all unique to the domestic piglet in today's systems.
A perfect storm. Okay.
Yeah.
What's factor number one?
First, it's genetics. Decades of selecting for really rapid growth. Huge litters, fantastic for productivity, obviously.
Yeah.
But the sow's ability to get iron across the placenta to those piglets, it just hasn't kept pace. So they're born with critically low iron stores. We're talking maybe 40 to 50 milligrams total body iron.
Wow, 40 to 50 milligrams.
Yeah.
How long does that actually last them?
Barely any time at all. Maybe 3-4 days, tops.
Okay, so they start with almost no buffer. What's next in the storm?
That leads right into factor 2, their explosive growth. Modern piglets just grow incredibly fast after birth. To fuel that massive increase in body weight, build blood volume, they need something like 7 to 16 milligrams of iron every single day.
Whoa, okay, so compared to the 40 they start with.
Exactly. Those tiny reserves are gone almost instantly, wiped out in the first few days.
So born low, burn through it fast, makes sense. What else?
Factor 3 complicates it further. The sow's milk, it's just, well, it's notoriously poor in iron. A piglet might only get about 1 milligram a day from milk.
Just 1 milligram. When they need 7 to 16, that's a huge gap.
A massive gap. And here's the kicker. Trying to boost iron in the sow's milk by feeding her more iron, it doesn't really work.
Really? Why not?
It seems to be a physiological block. Her body just doesn't prioritize putting much iron into the milk, regardless of her own intake. It's a limitation in mammary secretion.
Huh. Okay, so genetics, rapid growth, poor milk supply. What's the final piece?
The final piece is really key to why we call it production-induced. It's the housing.
Indoor housing.
Yeah, these modern indoor confinement farrowing systems. They're great for hygiene, management, biosecurity, no doubt. But they completely cut off the piglet's natural access to soil. Wild pigs, or even pigs raised outdoors, they root around. They naturally pick up iron from the soil.
Ah, I see. So that natural supplementation behavior is just gone.
Exactly. Take away that environmental source and you expose this underlying vulnerability that now needs direct human intervention. Mandatory intervention, really.
Born low, grow fast, mom's milk doesn't help much, and no dirt access. That really is a perfect story. Okay, so we know why they're deficient.
Yes.
What does iron actually do, and how does not having enough lead to those symptoms, like the thumps you sometimes hear about?
Iron's role is absolutely fundamental. Number one job. It's the core component of hemoglobin.
In red blood cells.
Exactly.
Yeah.
Hemoglobin is the protein that carries oxygen from the lungs out to every single tissue in the body. It's also key in myoglobin, which stores oxygen in muscles.
Okay.
So oxygen transport, that's crucial for everything.
Yeah.
Energy, growth, basic cell function, just vitality. When iron is scarce, the piglet physically cannot make enough hemoglobin.
And that leads to?
That leads directly to anemia. Specifically, what we call hypochromic microcytic anemia.
Okay, hypochromic microcytic. Can you break those down for us? What does that actually look like at the cell level?
Sure. Microcytic just means the red blood cells are smaller than they should be. And hypochromic means they're paler than normal.
Paler because?
Because they don't have enough hemoglobin inside them, which gives them their red color. So smaller cells, paler cells, and generally fewer red blood cells overall. The blood's total oxygen carrying capacity just plummets.
Right, which leads to?
Tissue hypoxia. Basically, the tissues aren't getting enough oxygen. and that's the direct cause of the symptoms we see. Poor growth, weakness, lethargy.
And the breathing, the thumps.
Exactly.
Yeah.
That rapid, labored breathing, especially if they try to move around, that's the body desperately trying to compensate for the lack of oxygen delivery. It's working overtime.
Wow, okay. That paints a clear picture. Now, you mentioned something earlier about a hepcidin paradox with iron injections. That sounds odd. How can giving iron hurt absorption later?
It does sound odd, but it's fascinating molecular biology. The body has this really sophisticated system for controlling iron levels, making sure you don't get too little or too much. The master regulator is a hormone called hepcidin.
Hepcidin.
Hepcidin essentially acts like a gatekeeper. It can block iron from being absorbed in the gut, and it can also stop iron from being released from storage cells like macrophages.
So it lowers iron in the blood.
Right. Now, when you give a piglet a single large intramuscular iron shot, yes, it fixes the immediate problem. But the body sees this sudden, massive influx of iron and thinks, whoa, overload.
Ah, so it triggers a defense mechanism.
Precisely. It triggers a huge surge in hepcidin production. The body tries to slam the brakes on any more iron getting in.
So the injection itself causes the body to block later absorption.
Exactly. That's the paradox. You get this boom and bust cycle. Early surplus from the injection, followed by a period where hepcidin levels are really high, impairing absorption from, say, crete feed, and also messing with the recycling of iron within the body.
So that high hepcidin could actually increase the risk of them becoming deficient again later before weaning.
It certainly can, yes. Especially if they deplete that initial injected dose quickly, which the fastest growing ones might. It's a delicate balance.
That's a really important detail for managing them. And it's not just about growth and breathing, right? What about their immune system?
Oh, absolutely. Iron is critical for immunity, too. It's needed for immune cells like lymphocytes and phagocytes to multiply and function correctly.
So low iron means?
Low iron directly compromises both their innate sort of frontline defenses and their adaptive immunity, the more specific learned responses. Anemic piglets are just much more susceptible to catching secondary infections.
Like what kind of infections?
Things like scours, diarrhea caused by enteric pathogens, or respiratory diseases, pneumonia. Their defenses are down. It's interesting, too, even iron overload can mess with immune function. So it's all about maintaining that right balance.
Okay, so we've covered the causes, the physiology. Let's shift to the farm level. How do producers actually spot this? What are the telltale signs? And how do they confirm it?
Right, the practical side. The obvious clinical signs usually show up in the first 1 to 3 weeks. The most classic sign is paleness.
Paleness where?
You look at the mucous membranes inside the eyelids, the gums. They'll look pale, almost white instead of pink. In white-skinned pigs, their ears and snout lose that pinkish hue.
Okay, paleness. What else?
Lethargy is a big one. They're weak, listless, don't really want to get up and nurse. You'll see poor growth. They look stunted, maybe have a rough hair coat, wrinkled skin.
And the breathing.
And the breathing, yes. That labored breathing, the thumps, especially if they have to exert themselves, like competing for a teat. They also just get sick more easily. Scours are really common.
And in the worst cases?
In severe, untreated cases, you can sadly see sudden death. Usually from heart failure, because the heart's been working so hard for so long trying to pump oxygen core blood.
That's grim. What about if a piglet dies? Are there specific things seen during a necropsy, an examination after death?
Yes, the necropsy findings are pretty characteristic. You'll see that generalized pallor across all the tissues. The blood itself looks thin, watery. The heart is often enlarged and flabby, maybe with fluid around it that's hydropericardium. You might also see an enlarged spleen and fluid buildup, edema in various tissues.
So those are the clear, overt signs. But you mentioned earlier this idea of subclinical deficiency. How does that work? They look okay, but they're not.
That's such a critical point. Subclinical deficiency is where the piglets don't show those obvious dramatic signs. They might look relatively normal, but their iron levels are still too low to support their full potential. Their growth rate is reduced, their feed efficiency isn't as good, and importantly, their immune system is still compromised, even if they aren't outright anemic. This hidden deficiency is often a major economic drain.
Okay, so how do you catch that? Or confirm the overt cases definitively?
For a definite diagnosis, you need blood tests. Hematology, that's the gold standard.
Right, the lab work. If a producer gets a report back, what are the key numbers they're looking for?
Primarily hemoglobin levels,
Yeah.
generally below about 80 or 90 grams per liter. That's clear anemia. between 90 and maybe 110. That's often considered subclinical.
Okay, hemoglobin. What else?
Hematocrit or packed cell volume,
Yeah.
PCV, basically the percentage of blood made up of red cells. Below 20% is typically diagnostic for anemia.
Mm-hmm.
And then the red blood cell indices are really informative. Things like MCV, mean corpuscular volume, and MCHC, mean corpuscular hemoglobin concentration. If those are low, it confirms the cells are small and pale, that classic microcytic hypochromic picture we talked about. That's really characteristic of iron deficiency.
Got it.
You can also look at serum iron levels directly or transferrin saturation, which shows how much iron is being transported. Low levels there give direct evidence of depletion.
Okay, so we understand the problem, how to spot it, how to confirm it. Let's talk solutions.
Yeah.
How is this actually managed day to day on farms, and what's coming down the pipeline in terms of innovation?
Right. The need for iron supplementation in modern pig production, it's just non-negotiable, really. The most common and arguably most reliable method historically is injection, parenteral supplementation.
The iron shot.
Exactly. The standard practice is usually a single intramuscular shot, typically 150 to 200 milligrams of elemental iron, given sometime in the first week, often day 1 to 7.
What kind of iron is that?
Usually iron dextrin or another one called gleptofuran. There's some evidence gleptofuran might be a bit more bioavailable, absorbed better.
Okay, so 150, 200 milligrams. Is that one shot usually enough to get them through to weaning, especially these super fast growers?
That's the million-dollar question. And increasingly, for the most modern genetics, the answer is often no.
Ah.
Research, like studies out of Kansas State, clearly shows that 200 milligrams is better than lower doses for getting them through the nursery phase well. And timing matters too.
How so?
Giving the shot on day 4 or even day 6 seems to result in better growth compared to giving it really early, like day 2, maybe lets their system stabilize a bit first.
Interesting. But even with 200 milligrams at the right time?
Even then, a single 200 milligram shot is often proving insufficient for today's best pigs. You still find a significant number, especially the biggest, fastest growing ones in the litter, are becoming iron deficient or even anemic again by the time they're weaned.
So what's the solution then? A second shot.
That's becoming increasingly common, yes. A second 200 milligram injection, maybe around day 14, has shown really good results. It helps ensure their hemoglobin levels are normal at weaning and definitely improves their growth after weaning, too.
Okay, injections are reliable, but maybe need tweaking. What about oral options? Giving it by mouth seems less invasive.
It is less invasive, which is appealing. You see things like iron pastes, liquids given orally, or providing access to iron-fortified crete feed, or even putting iron-rich soil or special peat moss in the pen.
But there are downsides.
There are challenges, yes. You often need multiple doses. Intake can be really variable. The strong piglets might get plenty, but the weaker ones who need it most might not consume enough. And the newborn piglet gut isn't great at absorbing iron in those first few days anyway.
So consistency is an issue. What about combining methods?
That's looking quite promising. Trying to get the reliability of the injection with the sort of top-up potential of oral.
Like what kind of combination?
One strategy that looks effective is giving that single 200 milligram injection early, say day 4, but then also providing free choice access to something like iron-enriched peat moss right up until weaning.
And that works as well as a second shot.
Studies suggest it can be just as effective in maintaining iron levels and potentially easier from a labor standpoint than rounding them all up for a second injection. Plus, maybe better for welfare.
That does sound like a smart compromise. Any completely new types of iron supplements being developed?
Yes, there's some really interesting innovation happening there, particularly with novel oral formulations designed for better absorption. One example is something called sucrosomial iron.
Sucrosomia. What's special about it?
Basically, the iron, its ferric pyrophosphate, is encapsulated, sort of wrapped up in a special matrix involving phospholipids and sucresters.
Okay. What does that do?
It's designed to protect the iron as it goes through the stomach and then allow for much better absorption further down in the intestine without causing the gut irritation you can get with some traditional iron salts.
So potentially much more effective oral delivery.
That's the idea. Early studies, using preterm piglets as a model, actually, show it has high bioavailability, comparable to standard iron supplements like ferrous sulfate, but crucially without triggering inflammation or oxidative stress in the gut.
Wow. That could be a game changer for oral supplementation if it pans out commercially.
It definitely represents a promising avenue for non-invasive yet highly effective oral iron delivery in the future.
Now, on the flip side, iron is essential, but can you give too much? Is iron toxicity a risk?
Yes, absolutely. Iron is definitely toxic in excess. Though, thankfully, toxicosis in piglets is almost always due to accidental overdose of supplements, not from feed or milk.
What makes them susceptible to overdose?
A major predisposing factor is the sow's nutrition. Specifically, if the sow was deficient in vitamin E and/or selenium during pregnancy.
How does that connect?
Vitamin E and selenium are crucial antioxidants. Piglets born to deficient sows have a weakened antioxidant defense system. So when they get hit with a large dose of iron, which itself can be pro-oxidant, their bodies can't handle the oxidative stress.
And what does that look like?
It can be dramatic and sudden: collapse, shock, sometimes vomiting, difficulty breathing, often leading to death quite quickly.
So prevention is key there, through the size diet.
Absolutely. Ensuring the sow herd has adequate vitamin E and selenium is the best way to prevent this specific risk associated with iron injections.
Okay, let's bring this all together. We understand the mechanisms, the solutions, but what's the bottom line? What are the real-world, tangible economic impacts for producers? What's the ultimate so what here?
The so what is huge, actually. The consequences of letting piglets become iron deficient, even mildly, extend way beyond weaning. They cast a really long shadow over that pig's entire life performance.
Also, doesn't growth catch up later?
That's the critical point. Often it doesn't fully catch up. The growth deficit they incur in those first few weeks, it's frequently permanent, even if their blood work looks normal later on.
Seriously, can you quantify that?
Yeah, there's data.
Yeah.
One study showed pigs that were anemic at weaning were still almost a kilogram, 0.82 kilograms lighter 3 weeks after weaning. Another found pigs anemic early on were still 34% lighter, way out at day 61.
Wow, 34%. That's substantial. So this directly hits their final market weight.
Absolutely. That failure to achieve what we call compensatory growth means those early setbacks translate directly into lower weights at slaughter. That research comparing 1 versus 2 iron shots, the pigs getting the second shot, preventing that late pre-weaning deficiency, were around 3 kilograms heavier at market.
3 kilos heavier, just from ensuring adequate iron early on. That must have major financial implications.
It really does. And it's not just about the direct costs, like losing piglets, which can be devastating in untreated litters, up to 80 or 100% mortality in severe outbreaks, or the cost of the iron supplement itself and the labor to give it.
What are the bigger costs then?
The biggest financial drain is often the indirect subclinical stuff in the pigs that survived but were compromised. Reduced growth rate, poorer feed efficiency. That means more days on feed, higher feed costs, more labor, more barn space tied up.
And the immune system link.
Exactly. That compromised immunity leads to increased morbidity, more sickness. They're more susceptible to costly diseases like PCV2, porcine circovirus, which can wreak havoc, or common scours and respiratory infections. There was an estimate that PCV2 alone cost the UK pig industry over $50 million a year, and poor iron status makes pigs more vulnerable.
Those numbers really drive it home. It's a systemic issue impacting the whole herd's health and efficiency.
It is, which makes the economic case for getting iron supplementation right incredibly strong. One analysis estimated that spending an extra, say, 12 cents for that second iron shot could return over $10 per pig.
$10 back for a 12-cent investment.
Yeah, mainly through that extra carcass weight, about 6.6 kilograms in their model. That's a massive ROI. Compare that to the cost of not managing it well. Neonatal diarrhea alone, often linked to poor immunity from anemia, can cost a producer something like €134 per sow per year.
Okay, that clearly frames it as a high-leverage investment, not just a cost center.
Yeah.
So for producers listening, what are the top strategic takeaways? What should they be doing?
First and foremost, benchmark and monitor. Get away from a one-size-fits-all mindset. Regularly check hemoglobin levels at weaning in a sample of pigs. See if your current protocol is actually working for your genetics and your system.
Use data to guide decisions.
Yeah.
Makes sense.
Second, tailor the protocol. If you have high-performing genetics, big litters, fast growth, that standard single shot is probably not enough. You need to seriously consider intensifying, whether that's a second injection around day 14 or maybe one of those combined injectable plus oral strategies.
Adapt to the pig's needs. Got it. What else?
Third, optimize administration if you're injecting. Aiming for day 4 to 6 seems to give the best growth response compared to day 1 or 2. Little details matter.
Okay.
And finally, don't forget the sow. Manage her health, specifically ensuring adequate vitamin E and selenium intake during gestation. That's your insurance policy against iron toxicosis risk in the piglets. It equips them to handle the iron supplements safely.
This has been a fascinating deep dive. It really highlights how something seemingly so targeted, like iron for piglets, connects to genetics, housing, immunity, economics. the whole system.
It really does. When you step back, iron deficiency in piglets isn't just a simple nutrient gap. It's this complex, multifactorial issue that's almost baked into modern high-output swine production because of the very genetic progress we've made.
So it's not about bad farming, it's about managing an inherent challenge of the system.
Precisely. It's a physiological dependency we've created through selection. So managing it effectively isn't just about fixing a problem. It's fundamental to animal welfare, herd health, and ultimately economic sustainability. It's one of those interventions with a really high impact.
So if there's one core takeaway for you, our listener, from this deep dive, it's perhaps this. Iron deficiency in piglets isn't a failure, but rather a systemic consequence of our success in breeding highly productive animals. It makes precise, mandatory intervention absolutely crucial. It's a complex challenge born from modern agriculture itself.
Well said.
And it kind of leaves us with a broader thought to ponder, doesn't it? Considering the incredible precision and, the sheer scale of modern agriculture. What other hidden physiological dependencies might we have inadvertently engineered into our food systems? And looking forward, how will future innovations continue to address these complex balances?